My name is Charles Yancey, and I'm here to chair the hearing to discuss docket number 0451, order for a hearing regarding the resources and services available to individuals with sickle cell disease. This matter was sponsored by yours truly, Councilor Yancey, and referred to the Committee on Labor, Youth Affairs, and Health on March 13, 2013. Members of the public have been invited to attend, and I am required to inform all the attendees that this committee hearing is being taped for rebroadcast at some point, and you're being recorded live for cablecast. So if you're anyone at home at channel A8, you're witnessing this hearing on sickle cell disease live, but it will be recablecasted. For the purposes of this hearing, I will ask those testifying to offer the names, residential address, and title, and brief testimony. Whereas sickle cell disease is an inherited disorder that affects the hemoglobin, the molecule in red blood cells that delivers oxygen to cells throughout the body. Signs and symptoms of sickle cell disease usually begin in early childhood. Characteristics, features of sickle cell disease includes anemia, repeated infections, periodic episodes of pain. And whereas, according to the Center for Disease Control and Prevention, sickle cell disease affects millions of people throughout the world and is the most common inherited blood disorder in the United States. The CDC estimates that the sickle cell disease affects between 90 and 100,000 Americans and occurs in 1 out of 500 African American births and 1 out of every 36,000 Hispanic births. And whereas the sickle cell disease is a major public health concern, as the life expectancy of persons with sickle cell disease is reduced because patients suffer progressive tissue and organ damage and are prone to bacterial infections. And whereas in the United States, babies are screened for the sickle cell disease at birth, allowing for early treatment. However, significant gaps remain in continuing care for children and adults affected by the disease. And whereas many area hospitals offer programs and treatment protocols for patients affected by sickle cell disease, including the Brigham and Women's Hospital, Boston Medical Center, Dana-Farber Cancer Center, and the Tufts Medical Center. And whereas it is imperative that the City of Boston ensure that the sickle cell patients receive services and treatment from birth through adulthood, including preventative care, education, ongoing counseling programs, and access to communication networks to improve the quality of life for sickle cell patients. Now, therefore, be it ordered that the appropriate committee of the Boston City Council hold a hearing to examine the resources and services that are available to individuals suffering from sickle cell disease, and that representatives from the Boston Public Health Commission, the State Department of Public Health, the Boston Public School Departments, Brigham and Women's Clinic, the Joint Center for Sickle Cell and Thematic Disorders, the Massachusetts General Hospital, the Children's Hospital, the Boston Medical Center, and the Greater Boston Sickle Cell Disease Association, and other interested parties be invited to attend. This hearing is being chaired by myself. The chair of this committee, unfortunately, is not able to join us. Councilor Arroyo asked that I chair in his stead. He is very committed to this issue and is going to make every effort to be here, but he had an unforeseen conflict. So we shall begin first with some very brief introductions before we have the slideshow presentation. So I'm going to go from my right and your left, go around, have everyone introduce themselves, and then we will return to Dr. Stevenson for some opening remarks, and then very briefly from our Reverend, who unfortunately has to leave very shortly, and then the doctor will open things up with her slideshow presentation. So with that in mind, we'll start with you, Doctor, just for brief introduction, and then I'll come back around.
I am the president and founder of the Greater Boston Sickle Cell Disease Association. I've been involved in the struggle against sickle cell disease for over 20 years, and I am just so privileged to be here this afternoon. So delighted to see the interest in sickle cell disease being taken by everyone here today. Thank you so much.
Thank you.
Thank you.
Yes.
Jason Calianos, board member of the Greater Boston Sickle Cell Disease Association.
Okay. I noticed you haven't mentioned your residence.
My residence is 461 Main Street in Hingham, Mass.
All right. Thank you very much. Doctor?
I'm Philippa Sprintz. I'm the director of the Division of Pediatric Hematology at Boston Medical Center and a board member of the Greater Boston Sickle Cell Disease Association. My residential address is 1 Worcester Square, Massachusetts, Boston, Mass.
Thank you very much. Yes.
I'm Dr. Barry Zuckerman. I'm a pediatrician at Boston Medical Center, former chairman of the department for 20 years, and I live at 16 Greenwich Park in Boston.
Thank you. Yes.
My name is.
Can you speak right into the mic?
Yes.
All right.
Good afternoon. My name is Dr. Hui Nguyen. I'm the medical director at the Boston Public Health Commission. My place of residence is 27 Hilda Street, Quincy, Massachusetts.
Okay. Very good.
My name is Charles Homer. I'm a pediatrician. I'm the CEO of the National Initiative for Children's Healthcare Quality. My residential address is 76 Green Street in Brookline.
Thank you.
Yeah, William Dickerson. I'm the senior pastor of Greater Love Tabernacle, 101 Nightingale Street in Dorchester, and the chair for the statewide Black Clergy for Unity at the Dilway Thomas House in Roxbury.
Very good.
My name is Rajan Sonic. I'm an attorney at the Medical Legal Partnership Boston and an Equal Justice Works Fellow. And my residential address is 221 Massachusetts Avenue in Boston.
Thank you.
My name is Laura Taylor. My residential address is 95 Pleasant Street, Norwood, Mass. I am a parent of a 19-year-old young lady in the audience who has sickle cell anemia and a member of the Greater Boston Sickle Cell Disease Association.
Well, thank you very much. Reverend, we'll begin with you, then go to Reverend Dickerson, and then to Dr. Fleet.
I first want to say thank you so much, Councillor Yancey, for tabling this resolution that we're here to support this afternoon. Thank you for all the support that you have given to us in the community. I want to thank also the Boston City Council for allowing us to come in today and to present the information that we have concerning sickle cell disease and to talk a little bit about what patients with sickle cell disease are struggling with today. It is indeed, like I said, an honor for me. I've been an advocate for patients with sickle cell disease for over 20 years. I got involved in this struggle 20 years ago when I met a young lady who had sickle cell disease. I was a seminary student back then, and after listening to her life story and the hardship that was presented to her by sickle cell disease, I was moved to do something about it. Her name was Devona Marshall, and she passed away at around her 30th birthday. She kept a journal of her life, and I had an opportunity to read her journal, which moved me to tears. I was saddened when I learned of the multiple times that she was hospitalized and, you know, the effects of the disease upon her body. But despite that, she kept pushing herself and was able to graduate high school. What moved me most about Devona's story is when she shared with me that even though she lived a life of pain because of her disease, what she found the most painful that no one seemed to care. At that moment, I committed myself to showing Devona that indeed I do care. I first made an attempt to learn about the disease, and this led me to a hematologist at Brigham and Women's Hospital who educated me on the complications caused by the disease on a person's life. With the help of this doctor, I was able to start a support group for a small group of patients at the time who suffered from sickle cell disease. And this group has now evolved into the Greater Boston Sickle Cell Disease Association. I'm here in honor of Devona today. She's not here to tell her story, and so I'm here. She asked me back then if she could get an opportunity to tell her story. And, so I'm here representing her today. My main involvement in the community is to mobilize people and engage people into this fight against sickle cell disease. For 20 years, I've seen the devastation it has caused on so many patients and on so many families. They need services. They need to know that they live in a city that really cares for them. They need to know that they have access to health care of the best kind. They need to know that that they can live their life, and they too can have a good quality of life. And so I'm here to advocate for them today, and that's what I try to do.
Well, thank you so much, Reverend, for your service, and thank you for inviting me to become a member of the Board of Directors. I'm there in spirit for all those meetings that I miss.
So welcome, so welcome.
Okay, at this time, I'd like to hear from Reverend Dickerson, and unfortunately, he won't be able to stay much longer, so if you folks don't mind taking him out of order, I'd like to do that at this time. Reverend Dickerson.
Thank you, Councilor Yancey. And I want to thank Reverend Stevenson and all those that work with him with the Greater Boston Sickle Cell Disease Association. I, for a number of years, have chaired the Health Committee for the Black Ministerial Alliance of Boston, and I also did a lot of work with and continue with HIV and AIDS population. And I want to commend everyone that's here, because lending your voice to the disparity that we see as it relates to sickle cell is so important, because some people that can't be here, they need someone to speak up for them. As we see this disease impacting so many in particular, people of color, in particular those of African diaspora, we need to recognize that coming together to lend our voice to support them means a lot, so that we could try our best to encourage those who make decisions as it relates to funding, so that education and awareness can go forth on a greater level. As a former school teacher in the Boston Public Schools, I've witnessed firsthand many youth who have not received the proper health care in regards to sickle cell anemia and other diseases that have impacted students of color in particular. And I've known how the impact that has touched their lives has adversely impacted their families, and it's something when you have to care for a child that's sick. My grandson has a sickle cell trait, and we watch his progress health-wise on a regular basis. And I just want to urge those that are here and those who are making decisions to stand with groups such as Greater Boston Sickle Cell Disease Association, stand with such leaders as Reverend Stevenson and others who are standing up for those that are dispossessed as far as the health disparity is concerned. They are dispossessed as it relates to the fairness in health, may I say, and they're part of the health disparities that's going on now. And many in the community do not know much about the sickle cell disease, and they need to be educated. And those who are suffering with it need to be cared for at the optimum level. and not to be put to the side because of some economic barriers. So I thank God that I'm here, and I will continue to lend my voice in any way I can so that we can stand up audaciously together and speak against what's not happening and speak up for some things that need to happen so we can get the funding and the awareness and the mobilization that's needed to bring this to the forefront of dealing with health issues in Boston and the surrounding areas as well. Of course, the country, because we want everyone to be healed. Yes. We want everyone to be well. And I thank you for this opportunity, Councilor Yancey.
Well, thank you so much, Reverend Dickerson. We appreciate all the work you do, not only on this issue, but so many others that impact our community. And we're well aware that when families are in need because of a tragedy, a community disorder, you've always been there. And I want to say thank you so much for that.
You're welcome. Thank you very much. You're welcome.
Dr. Sprintz, the show is now yours. We can dim the lights for the PowerPoint presentation. If that's too dark, let us know. Just want maybe bring it down a little bit more, Lincoln. A little bit. Maybe we can. All right. Okay. Is that okay for everyone?
For the audience. Yeah.
Okay.
So firstly, let me say thank you so much, Councillor Yancey, for letting us do this.
Even though I don't see you, I do hear you very well.
No, I hope not too well. I hope not too loud. But no, firstly, just to say thank you very much for letting us be here to do this today. I need to add my voice to the others that have just spoken to say that this is an absolutely wonderful opportunity. I then have to thank all the community, both those who are here and those who I provide care for back in Boston Medical Center, which is my medical home, for trusting me to provide the medical care. So I'm just a pediatric hematologist with an interest in sickle cell disease. I didn't learn that from where I come from. I come from the north of Scotland. That is not very affected by sickle cell disease, but I will take just a few minutes to give you an overview of this condition as we understand it in 2013. And if this works, this slide is just, these are photomicrographs, pictures of cells which are affected by sickle cell disease in one way or another. Sickle cell disease was first described as long ago as 1904. At least it was first described in the West at that time. We know that it was described in West Central Africa and other areas from long before that time, but this was the first written description. It actually wasn't written up in 1904, it was written up in 1910, but this is the result of the blood smear, and I don't know, oh, it does show. And this was of a dental student who presented to a hospital in Chicago shortly after he came from Grenada. He had sickle cell disease, and he presented with a fever and with what we could call a pneumonia. He was found to be sick enough to need admission. Blood work was done, and this is what was seen. So this is just me adding a little trimming to the slide, but this is what was seen, and this is the original pictorial drawing of what sickle cells looked like. This takes us almost 100 years later to a paper that I share with you in part because of the author. So the author is a professor at Boston University School of Medicine, Boston Medical Center, Dr. Martin Steinberg, and he really represents the cutting edge of research for sickle cell disease, understanding more and more as we do about the genetics of this disorder. It's an inherited disorder. It cannot be caught. It cannot be acquired by touching anybody. It is solely an inherited disorder, but solely does it an injustice because it's inherited in a very straightforward way. It can affect 1 in 4 children born of both parents if both parents are carriers of the disease. This picture may be a little bit complicated. Oops, I'm sorry. May be a little bit complicated, but the goal of it is to show what is normal red blood cells. Sickling is the process of abnormal red blood cells taking up this configuration when things are bad for the red cells. The red blood cells carry oxygen in our body. Inside the red blood cells there is a protein. That protein is known as hemoglobin. Normal hemoglobin happily retains or causes the red cells to retain this nice normal round red cell shape. Unhappy hemoglobin, that is when red cells are without oxygen, when they're dehydrated, when there's a fever going on, they can end up with the hemoglobin taking on this long chain-like configuration that produces then this sickle, this scythe-like shape of the red cell, and a lot of the problems related to sickle cell disease, though by no means all, relate to red blood cells like this sickle cell becoming stuck in the blood vessel. So the bottom frame represents a blood vessel, and within this blood vessel there are some normal red blood cells, because most of the time individuals don't have all their cells in the sickle shape, but sickle cells that stop red blood cells from flowing normally. And the consequence of this is multiple, leading to many of the complications that we do understand of sickle cell disease. As actually Councillor Yancey mentioned in his initial presentation, in the West, in the United States and in other countries in Western Europe, we screen for sickle cell disease at the period of birth. This is a slide just depicting the nurse who has in her hand the heel of this little newborn baby, and in her left hand a card that is collecting some drops of blood. We identify individuals in this part of the world with sickle cell disease as early as within about 48 hours of birth. And we believe that this is advantageous because this allows us to institute therapy that hopefully is going to start these children on a trajectory to a better, more successful, better quality of life, despite having inherited this blood disorder. And then this just gives you some numbers, and I'll run them down all at the same time and then explain to you why I decided to show you these. The first three bullets have question marks, and this is a testament to the fact that we really don't know all that we need to know about sickle cell disease by any means. We don't have a national registry. We certainly don't have a global registry. In Africa, we don't even have medical records to be able to keep the details of the individual patients who have been identified. At current counting, we think there are probably near to 100,000 individuals in the United States with sickle cell disease. We think that there are probably somewhere like 300,000 new cases in the world, and we think that Africa has somewhere around 200,000. Since 2006, all states in the United States screen for sickle cell disease and the newborn babies, like I showed in the earlier slide. So that we do have numbers on. And we know that there are approximately 2,000 new cases of sickle cell disease in the United States each year. And we know in Massachusetts that that translates to about 40 babies being born with sickle cell disease in this state each year. Most of them to the east. When I worked out in Springfield, we would have 4 to 8, some in Worcester, but the majority here in Boston. And just to give you a few more numbers, in the United States, those people who claim African descent, sickle cell disease occurs in about 1 in 600. 8% of the population in this country, a large number, actually carry the gene for sickle cell disease. And as the gentleman who spoke before me shared that his son has sickle cell trait, this is part and parcel of us understanding the whole illness, is to understand the individuals who have the trait. This is the carrier status, and we hope that all individuals with the trait do very well and grow up and have normal productive lives. But we do know that there are occasionally some little problems associated even just with carrying the gene. Sickle cell disease is not exclusive to what is oftentimes considered the African American community. Sickle cell disease now, because of interreproduction and global travel, actually exists in most populations. There are some that it is more common in, and there is absolutely no doubt that it is most common in individuals from sub-Saharan Africa. But there is a very large population of individuals in North India which is affected by sickle cell disease, another large population in Arabia, and in this country, as many as 7% of the US Hispanic population has sickle cell disease. So this is not a trivial condition by numbers by any means. And the numbers that I can give you is that there are somewhere between 1,500 and 2,000 individuals in the state of Massachusetts affected by this disorder. And this is just a graph, it's a few years old, but again, shows that the predominant group is what has been labeled here as black, but of African descent, but that Native Americans, Asians, Hispanics, and even whites are affected by this disorder. So we must take that step back and say this is not exclusively a black, an African American disorder. It affects everybody. Sickle cell disease has a multitude of complications, and I'm not here to in any way take time to go into details of these. Even just looking at this slide without reading it shows you that there's a long list of things that can go wrong for individuals with sickle cell disease. At the top of the list is infection, and in time past that used to be the most major problem for us pediatric hematologists. Children would catch particularly what is known as a pneumococcal infection and could readily die from this. This is the driver for our newborn screening. We identify children at birth with sickle cell disease, and we start them there and then on what we refer to as prophylactic penicillin. That's just that we ask the parents to give the baby penicillin twice a day. We continue it till they're 5 years of age. The next most major problem that we face with our individuals with sickle cell disease nowadays is in the group of lung disease. There's a condition known as acute chest syndrome, which is essentially pneumonia in the patient with sickle cell disease. Asthma is a bad problem in individuals with sickle cell disease, and those two work hand in hand very much to the disadvantage of the patient. And then pulmonary hypertension is evolving as a more significant problem, more so in the adult population, but is very definitely a significant complication of this illness. And then only to mention, strokes occur particularly in children. They have complications, these patients, in their eye, in their gallbladder, in their liver. And of course, the sentinel event in individuals with sickle cell disease is that of pain. When the blood vessels get closed up by the sickle red blood cells, blood doesn't flow, and the pain of sickle cell disease is really exactly the same pain as the people that people do learn about when they talk about heart attacks, or what we refer to medically as myocardial infarctions. Infarction describes death of the tissue beyond where the blood flows, and that's exactly what happens in sickle cell disease. So for anybody who doesn't know what pain in sickle cell disease means, and I know that that's not the case in the audience here, but for perhaps people who are listening, it is as bad as having multiple myocardial infarctions in multiple areas of the body all at the same time, over and over again. So this is not a gentle disease. We can cure sickle cell disease. It is a curable disease. And I'm not here to do the long medical talk. There are actually differences in the approach to sickle cell disease in this country to the approach in Europe. The idea of curing sickle cell disease was started in Belgium, where patients were transplanted. So this is referring to bone marrow transplant. And we can cure any and all individuals with sickle cell disease if we have them undergo bone marrow transplant, where we change the sort of red cells that they make. And this is a bit of a medical slide, but it's very straightforward. This is % survival after bone marrow transplant. And this is the number of years after transplant, and carrying out to beyond 8 years, as many as 94% of individuals who undergo a bone marrow transplant for sickle cell disease are still alive, and they are alive without disease, and they are cured. That they have no problems at all, the number is a little bit smaller at 84%. Bone marrow transplant, unfortunately, is not a simple procedure. And what we need to do, and what we want the City of Boston to be a leader in, among many other things, is to let us find simpler and more straightforward ways of curing this disease so that people do not have to live with this disease that causes as many problems as I've just shared with you. So I will stop there and just thank you for the opportunity and the honor of presenting a little overview of sickle cell disease.
Okay. Thank you very much, Mr. Smith. Dr. Smith, I've been following your career for many, many years, and you really have been a godsend to us here in Boston. I want to thank you for your work. But and then we'll go to the next witnesses. But before doing that, could you describe the difference between the sickle cell disease and the sickle cell trait?
Sickle cell disease is the situation whereby the individual affected has inherited 2 genes. So one gene will produce a certain percentage of this abnormal hemoglobin. 2 genes produces double that percentage. The patients with sickle cell disease have almost all of their red blood cells containing abnormal hemoglobin, and it causes an illness. Sickle cell trait is when the individual has inherited only one abnormal gene. These individuals do make abnormal hemoglobin, but less than 50% of this hemoglobin, this protein in the red blood cell, is sickle. We do know that there are some situations that can arise in individuals with sickle trait. We're learning, as we're paying more attention to this condition, that there may be more problems, more issues that people with the trait should know about. But it is not a painful, devastating condition that the disease is.
Thank you very much. Before we go to Dr. Zuckerman, I see we have been joined by another witness here. Could you mind introducing yourself? I'd like to have your name, residential address, and title.
Dr. Sofia Damia. I work at Dana-Farber Cancer Institute, mostly involved in translational research, and I'm from the Department of Medical Oncology here at Dana-Farber. I'm associated also Harvard Medical School.
All right. Well, thank you very much. Thank you. Dr. Zuckerman, welcome.
Well, thank you very much, Councillor Yancey, particularly for having this hearing. It's particularly important having this hearing, and hopefully as a first step, because I'm going to speak about the social context of sickle cell, as my colleague Dr. Sprintz talked about the biologic context, and the invisibility and silence in the public and the media is obvious and deafening. And I think reflects a core problem with sickle cell. It's a lack of societal attention and support. And this really contrasts with so many other diseases in the last 20 years. And we'll talk about, the explanation for this, and then hopefully what we can and should do. For myself, I have a brother 2 years younger who was disabled, and in the late 40s and early 50s, there was no public education for people with disabilities. There was no attention in the medical community. There was very little knowledge, and the best the family could do was really sort of do things on their own. There was a fair amount of stigma in that. So when I started when I was an intern at the old Boston City Hospital in 1972, I started caring for patients with sickle cell anemia, both in the emergency room, in the hospital, in the primary care clinic, and other settings. And, listening to parents and the adolescents, I started hearing recurring stories that I had experienced as a family member myself of parents being uncomfortable speaking to teachers or school folks about what their child had so accommodations could be made. Having the tutoring system structured in such a way that it was for children who were hospitalized for 2 weeks at a time, but not those, like many patients with sickle cell, that would only be in for 3 or 4 days. And it took us, took some attention on our part to get the school system to change that, to get children tutored. And the other thing is the lack of a real community support network for parents, for families, for children. And this differed so much from my experience of seeing children with cancer, seeing children with cystic fibrosis, seeing children with a whole lot of other diseases. So maybe I was sensitized to this notion of stigma, but I saw it, and I wanted to understand it a little better in sickle cell. And I went back and I did some reading and a little investigating. And, while it was discovered, as Dr. Sprint said, at the turn of the last century, in 1950, there are quotes, particularly in parts of the country, they called sickle cell anemia, it was a disease of bad blood. That says the stigma right there. Here you have a disease of a particular group of people, and their body turns against them to cause pain, and it's bad blood. I guess if you have bad blood, you're a bad person. I mean, it really, it doesn't go much further than that. Civil rights had an important contribution to a lot of aspects of this country, but including sickle cell anemia. Senator Kennedy had hearings in the early 70s when he was chair of then, I think it was Health, Education, and Welfare, and he reported on papers that were done by Robert Scott. And Robert Scott published paper in the New England Journal, compared public funding for research of sickle cell anemia, particularly back then, a disease of African Americans, to 4 diseases that were primarily of of white people. One of them is cystic fibrosis, and I can't remember, the others were diseases that were less prevalent, but also primarily white. And not surprising, he found that the funding for each of these diseases per patient was more than it was for sickle cell. And the outcome of his hearing was money from the NIH to develop comprehensive sickle cell centers, which we had during the whole length. Dr. McMahon is here and was in charge of that from 73, 74 on, if I remember correctly. And then what has happened since then? Since then, as civil rights changes and wanes, the funding for sickle cell anemia from the federal government has continued to gone up slightly, but the funding for, again, cystic fibrosis, the disease of whites, has gone up more. So, and that again probably reflects attention, priorities, advocacy, and it's, no matter how you cut it, it's an inequity and needs to be addressed. The situation now, maybe 5 years ago, so there are about, just say approximately half the, if sickle cell anemia, say, let's say 80,000 is a round number in the U.S., they're half that number of people with cystic fibrosis, say 40,000, just as a round figure. From NIH, there was $130 million for research in cystic fibrosis and $90 million for sickle cell. Twice as many in sickle cell, less money for research. In addition, private philanthropy has become important for all diseases. You know, the advertisements in the media, on TV, asking for money, media stars asking for money is pretty significant. So the private philanthropy for cystic fibrosis, and I'm just making these comparisons, was $150 million 5 years ago. The money for Sickle Cell Association of America, not here in Boston, America was $500,000. 300-fold difference. Wow. What does that money buy you? Well, for all diseases, whether it's cystic fibrosis or cancer, which has people of all races primarily, or other diseases, it provides a lot of support networks for information, to help families. You know, it's the money that families and others can get together in a community. What do you need? How can we help? How can we help organize the public and private sector to support any family who has a child or an adult, you know, particularly with a chronic disease? When you add up the dollars today, public and private, it's $10, $9 for cystic fibrosis per patient for every dollar for cystic fibrosis. And again, basically my point is there are inequities. There's inequities in healthcare. But what the money does, the Cystic Fibrosis Foundation uses their money to leverage clinical improvement to which the programs have to show to get the research money. So money's leverage the kind of changes that are needed. We all do the best we can in hospitals and clinics, but sometimes you need money to have the resources to make the kind of difference. So I wanted to lay that out here and say, you know, you, sir, have called this meeting, and I think hopefully it's a first step to get the kind of public attention that we need, that individuals with the disease, so adolescents with sickle cell anemia won't be embarrassed to tell their friends, so parents won't be embarrassed to speak to the teachers or others, because like every other disease, that's what happens. But when no one is visible, then there's stigma and there's embarrassment and maybe there's shame. The fact that there are no celebrities, public officials, and little media attention can and should be addressed. And I'm hoping the council can provide a leadership in this. And while, you know, while private monies are important, you know, it's going to be hard to compete with cystic fibrosis. So I still think there's a role for public monies to support organizations like the Greater Boston Sickle Cell Disease Association, which should be the heart and soul of kind of providing the support, what your image was, Reverend, that really can make a difference. Thank you.
Well, thank you very much, Dr. Zuckerman, and I certainly hear your hue and cry. There's great disparity that exists, and the next presenter represents the Boston Public Health Commission, whose budget is before us as we speak. I think they're looking for a little more than $60 million, so maybe we can negotiate on this. Not to set you up in that way, Dr. Nguyen, but why don't you introduce yourself again and offer your testimony?
Good afternoon, Chairman Yancey. My name is Dr. Hui Nguyen. As I mentioned, I'm the medical director of the Boston Public Health Commission. I'm also a primary care pediatrician and continue to practice part-time at the Dorchester House, which is a community health center in Dorchester.
Very good.
I want to thank you, Chairman Arroyo, and my colleagues and friends here who are testifying, and most importantly, everyone who's come out today to shine a light on the care of our residents suffering from sickle cell disease, which, as you pointed out, is the most common inherited blood disorder in the United States and affects nearly 100,000 Americans, particularly Blacks and Latino Americans. We are aware of the history of significant gaps in sickle cell research funding and clinical care that were highlighted here so articulately by Dr. Barry Zuckerman and also by former acting Massachusetts Department of Public Health Commissioner Dr. Lawrence Smith and colleagues in 2006. We are also very much aware of the implications sickle cell disease raises in relation to racial and ethnic disparities, which continue to persist in health and health care. Newborn screening and surveillance of sickle cell disease and sickle cell trait occur at the state and regional levels. In terms of research and clinical care in Boston, we are fortunate to have the Boston Comprehensive Sickle Cell Center, which is a center of excellence in sickle cell disease based at Boston Medical Center, as noted by Dr. Sprints, along with its affiliated hospital partners throughout the city. I think Dana-Farber and Children's Hospital are a part as well.
And Jimmy Fund.
And Jimmy Fund, yes, thank you. We are also aware of ongoing U.S. Health Resources and Services Administration funded work being done by Boston Medical Center in partnership with the National Initiative for Children's Healthcare Quality, Dr. Homer's here, to create a comprehensive and integrated system of care for sickle cell disease and sickle cell trait across the lifespan through partnerships with community health centers, community agencies, and schools. And I'm sure you'll probably hear more about at this meeting that this program includes improving local clinical care for sickle cell disease using quality improvement techniques. Currently, the Boston Public Health Commission does not have activities directly related to sickle cell disease or sickle cell trait, primarily because the activities of the Public Health Commission are, for the most part, applied more broadly to prevention initiatives rather than single disease entities, with a few exceptions, primarily communicable diseases such as HIV and chlamydia, which, as you know, also disproportionately affect African Americans. We are considering opportunities to work in conjunction with our healthcare partners to increase awareness of the importance of following up newborn screening results, particularly among the patients we serve in our child and adolescent health programming. There may also be opportunities for public health to work in partnership with healthcare and community agencies to advocate for improved systems of care coordination to ensure that all residents benefit from the current standards of sickle cell care as outlined by consensus reports by the National Heart, Lung, and Blood Institute and also the American Academy of Pediatrics policy statement. In this way, all patients with sickle cell disease and sickle cell trait can be identified early, receive timely acute treatment, and are not lost to care. And this includes newborns who are born at home or who immigrate from states or countries without routine neonatal screening, and particularly for older adolescents who are transitioning to adult care. So again, I want to thank you for calling this hearing and bringing us together, and I look forward to continued conversations with my colleagues.
Well, thank you so much for your testimony. I do intend to have a follow-up meeting with you, Doctor, as well as with Dr. Ferrer, who heads up the Boston Public Health Commission. Many years ago, we were successful in negotiating with Dr. Auerbach, the previous head of the Boston Public Health Commission, and that resulted in a line item within the Commission's budget dedicated to what we call the state of emergency, yes. Which of course deals with raising the level of awareness concerning HIV and AIDS. We may have to have a similar discussion about sickle cell, and that will probably happen sooner than later. But again, thank you for all the work that you do, and give our regards to Dr. Ferrer as well. Thank you so much.
Thank you.
Okay. You are next, and I believe you're Dr. Homer.
That's correct.
All right, Charles Homer, famous. I'll never forget your first name, anyhow, Dr.
Well, thank you, Councillor Yancey. And if I could also have my slides up, it would be helpful. So while the slides are coming up, again, I'd like to thank you, Councillor Yancey, for having this hearing and addressing the issue of sickle cell disease, which is of critical importance here in the city, and also express my appreciation to Reverend Stevenson for his leadership and the leadership of the Greater Boston Sickle Cell Disease Association in addressing this issue. I am, as several of my colleagues up here, I am a pediatrician by training, and I have the privilege of leading an organization called the National Initiative for Children's Healthcare Quality. The focus, our office is located approximately 2 blocks down the street on Winter Street, and we work across the country addressing a variety of clinical issues and clinical topics that affect children. Our focus is on improving quality of care so that children and their families will benefit.
Okay. Need some help with the... just give us 30 seconds to take care of the technical.
Great. One's always used to technology.
I remember when this was state of the art. These days, everything is web-based.
Right.
Okay.
At least I don't have to worry about my carousel of slides falling apart.
I remember those too. Just don't start talking about mimeograph machines.
Right.
Okay.
Terrific. Thank you.
And Kerry, thank you so much.
As Dr. Zuckerman mentioned, our interest really grew out of the awareness that there is high-quality care available for people with sickle cell disease in theory, but in reality that wasn't consistently achieved, and that there were efforts and strategies to improve care for populations such as, but not only people with cystic fibrosis, and that strategy was not being applied to the care of sickle cell disease. So we became very focused, working with Dr. Zuckerman and others across the country, as to how we could use the expertise of quality improvement to result in improvements for people with sickle cell disease. We have had the good fortune over the last several years of being the National Coordinating Center for 2 programs supported by the Federal Maternal and Child Health Bureau called the Sickle Cell Disease Treatment Demonstration Program and the Sickle Cell Disease Newborn Screening Program. We are working with 17 centers across the country, including Boston Medical Center, as one of those sites, and I'll describe that work in a minute. As Dr. Sprance indicated, the data we have about quality of care in the United States is actually abysmal. We don't have excellent data that allows us to say how good or how poor is the quality of care. The data I'm showing you are embarrassingly old. These are data that show that children, and again, you can see the dates on here, this is 20 years gone by, but it shows that children with sickle cell disease in Florida at that time were 5 times as likely to die in their first 4 years of life as children who lived in Virginia. When we see variation like this in outcomes of health, for us as people who are focused on quality of care, that suggests to us that somebody has figured out how to do things right, probably the people in Virginia, and somebody has not yet figured that out, in this case the people in Florida. And what we want to know is what are they doing right and how can we get everybody to practice in the best possible way. Another paper gave us some suggestion that this was true as well. These were early data about the use of penicillin, again, which is why we do the newborn screening. And this was from California and showed that for children on Medicaid in California, the idea is that children should receive penicillin every single day, which means they should get 365 days worth of the prescription of penicillin. And we saw for children in California that they only received prescriptions for, which doesn't mean they actually took it, 148 out of those 365 days. So again, to us that says we have a gap, or as the Institute of Medicine would say, a chasm in the quality of care between what we know people should get to get good outcomes and what they're actually getting. So what's another example of that? Again, Dr. Sprance already pointed out that one of the most significant omnipresent characteristics of this disease are severe episodes of recurrent pain. We would like to prevent that both through intensive therapies such as bone marrow transplant, but there are other therapies that I'll talk to you about. But regardless of those therapies, often people have acute pain. When I talk to patients and parents of patients with sickle cell disease, what I hear from them most compellingly and most passionately is the quality of care, or the lack thereof of quality of care, that they experience in emergency departments. And I'm not speaking specifically of ours in this city. I'm speaking to individuals across the country. What I hear from patients and their parents is that treatment is slow. When it occurs, it is not effective. Most patients know what optimal treatment of their pain episodes is, and often that is not the treatment they receive. And parents and patients often express in the strongest possible terms that the care they receive is not respectful. Is this the way it has to be? I certainly don't believe that this is how care has to be in the United States in 2013. So in our initiative, for example, we are working with centers across the country, and many of them have made a commitment to make dramatic improvements, such as setting goals so that 90% of children, for example, will get their first treatment within 30 minutes of arrival in the emergency department, or 90% after they get their first treatment will have their pain assessed to see whether that treatment was effective within the first 30 minutes. Boston Medical Center is one of the sites that's doing wonderful work on that. I had thought Dr. Sprans might show those data, so I don't have those here. I have it from another site, actually from across the country, but their data are at least as good. The point here, this is from a prominent medical center on the West Coast, an excellent center, but nonetheless, when they started looking, they saw that on average children were waiting over an hour and a half. And they found that once they started focusing on this and working to improve quality of care, they were able to reduce it to 30 minutes. Not that it couldn't be better, not that they couldn't be looking at quality even more effectively, but with, again, this isn't with inventing new medicines. This is saying, how do we take the treatment we have and simply focus, bring teams together, start measuring, involving families in the solution, redirecting the flow, prioritizing care. You can make a major difference in quality of care and quality of life and quality of outcomes. Now, the picture I have here is of Danelle Ivy. Danelle is a pediatrician, actually, who is the project officer at the Maternal and Child Health Bureau for our sickle cell programs. Danelle also is a patient with sickle cell disease, and I'm telling a story that he tells, so I know, and he's written it up, so it's public. He lived in eastern North Carolina. He was living a good life and doing well, but then started to experience complications of the disease, and it ended up with acute chest syndrome in the intensive care unit at the University of North Carolina, near death. He survived the experience, and his hematologist said to him, you know, there's a drug that's been approved, the one approved drug for the treatment of this disease in the United States, which is hydroxyurea. And that hematologist, it's a drug that has some complications, but those complications can be managed effectively. And we believe strongly that this drug is underused in the United States. Dr. Ivy, this is only a case of one, but he started taking that medication, and since he's been taking that medication, he hasn't ended up back with acute care hospitalizations or these acute complications. And again, to give an example, again, this one not from Boston, but this is from another East Coast city. This is from New Jersey, Newark, where that program that serves a large number of individuals, both children and adults, with sickle cell disease has focused specifically on improving the rates of use of this life-saving and life-altering, disease-altering medication. And in the treatments, you can see that they have now increased their rates from approximately 58% to now 74%, roughly 3/4 of the patients who are eligible to take this drug are taking it. So I give these examples simply to show that while new drug development is great, while research is important, while we need new approaches, if we focus on improving quality of care, we can make a real difference in the lives of patients. So I would love to see our city and the providers in our city working together with other providers across the state, across the region, and the nation start developing this comparative data to see how are our children and adults, because care for adults is at least as problematic as it is for children. How does our care vary across sites? Is everyone getting the treatment as promptly and effectively as they should be? How can we work together? The point is not to point a finger and blame. It's how can we work together to change our system so that outcomes are better? How do we involve families in a way, patients in a way to make these changes? How do we change our payment systems? Here in Massachusetts, we're doing all kinds of exciting things with payment reform. Rather than requiring a little payment for this bit of service, a little payment for that service, how do we encourage our state and others to launch payment reform so that programs and hospitals and practices are provided the appropriate incentives to actually improve care, reduce hospitalizations, and improve outcomes. So with that, thank you very much for the opportunity.
Dr. Homer, excellent presentation. Thank you very much. And you, like the other presenters, give us cause, you challenge us, but you also give us cause for hope.
Absolutely.
Particularly with your description of a real cure for sickle cell, something that I certainly hope we will explore aggressively after this hearing to make sure that that cure is truly available to all patients and that it's affordable.
Good. Thank you very much.
Dr. Adamia, I believe. Yes.
Good afternoon.
Good afternoon.
Ladies and gentlemen, as I mentioned, my name is Dr. Sofia Adamia. I am trained as a translational researcher, mostly for hematological malignancies, but I do have experience some solid tumors as well. Yes. And today what I would like to share with you, and I hope that you will be convinced how important it is to focus on the research, and not only research, but also to provide some support of patients with this devastating disease. And I can say that it is I call it devastating disease because it's considered to be an orphan disease. What does it mean is that people have this disease, but because there is not enough number of people carrying this disease, pharmaceutical companies, they did not really pay attention to develop new drugs or even approve some drugs. For example, this hydroxyurea, it's used for some of the leukemia patients. It has really very good outcome, and I'm very glad that it is used also sickle cell disease, people with sickle cell disease. Just I want to give you some statistics. When I started my graduate degrees, it was 2002 year, and that time I was working on myeloma, which is a bone marrow disease, and that time patients' survival were 2 months or 2 years. And today, I can ensure that we do have really great drug, and survival of the patient of that disease is 10 years. Another example is leukemias. In childhood leukemias, it's not a deadly disease anymore. 90% of children with this disease, they survive. Same thing with chronic myeloid leukemia. We have drug Gleevec, which was actually implemented at Dana-Farber first time, and the patient with this disease, they survive also 90%. What I want to say is that if we focus and if we designate some efforts, this will be in form of advancing research or increasing the quality life of the patient is absolutely necessary. Now, why do we need the money from government and not private organizations? For example, my research has been funded by many private donors as well as from Leukemia Lymphoma Society or from American Society for Hematologists. However, it is not enough. If we don't have money from government and support from NIH, our research would not be possible, and we would not get that point when we can say that childhood leukemias is cured. And I can assure you that if we mobilize more resources for this disease, from 10 years from now, we can say that it's curable. Another important thing is we need to screen more patients, more individuals for this trait. Because as previous speakers mentioned, It is not really disease for African American origin. Might be white populations, they do carry this disease, but we are ignoring them. And by chance, when they go to the hospital, for example, with other injuries, this will be discovered. And we do have examples like that for these cases. So that means that we do need three things to do. First, we need to screen population more effectively, and we need to have updated numbers of how many people carry this disease. Second, we need some resources for research, and the third, we need the resources to support the actually families, because they go through hell to just support their own children. And today, I actually represent my friend Lidl Adebayo. He's 2 years old, and he would love to be here. He carries this disease, but because of infection, he could not be here today. And thank you very much.
Thank you, Doctor, for your testimony and for the compassion that you demonstrate, as well as our other witnesses today. So at this time, I'd like to hear from my friend, Rajan. If you could reintroduce yourself and offer your brief testimony. Appreciate it.
Good afternoon. My name is Rajan Sonic. Again, I'm with the Medical Legal Partnership Boston, and I'm funded through an Equal Justice Works fellowship. Just as everybody else has indicated, I just want to thank Councilor Yancey for calling this meeting, and I just wanted to thank all of the teenagers and now young adults that I've worked with through a mentoring program called Strive, who have inspired me to do a lot of the work that I do, and in particular, a young man named Kenjo Kamara, who was on the radio with Councilor Yancey and myself just last week promoting this event, who couldn't make it to date because he's not feeling well. So those mentees are here in spirit. So when I was a sophomore at Harvard College, by chance I started volunteering with a program, with the Strive program that I just mentioned, and it was a mentoring program specifically for teenagers with sickle cell disease. It was the only one of its kind in the country. I knew very little about sickle cell disease at the time, but that soon changed. As I became heavily invested in the lives and challenges of my mentees, I saw how multiple systems that should have been helping these children too often acted as barriers to their health. I saw a mentee hospitalized with a pain episode after she was not allowed to wear her coat during an exam on a cold day at school, despite her attempts to explain that cold temperatures can trigger a pain episode. I saw another mentee hospitalized repeatedly in just 1 month due to the stress of almost becoming homeless after her supplemental security income, or SSI benefits, were wrongfully denied. I have also seen a young child with sickle cell disease hospitalized repeatedly when the landlord conducted renovations without taking the proper precautions to eliminate airway irritants like dust that can reduce lung function and also cause pain episodes. In each one of these situations, a legal advocate was ultimately needed to remedy the situation and to protect the health of the child. As I realized this, though, I also realized that each one of these situations could have been prevented if more coordinated professional and lay support systems existed to help families. However, as previous speakers have touched on, sickle cell disease has been a neglected, invisible, and stigmatized disease. As a result, the families in the examples I just mentioned did not have the kinds of supports that families affected by other serious and chronic illnesses did. Supports that can not only address problems, but can also prevent them. Instead of a well-resourced network of support to help these families advocate for themselves with schools, government agencies, and landlords, these families were largely left to fend for themselves. But you might ask, why is this particularly problematic? Aren't most families left to fend for themselves in this way? The challenge here is that a large number of people with sickle cell disease experience multiple overlapping vulnerabilities. First, a majority of individuals with sickle cell disease are low income, and poverty in and of itself often causes cyclical crises. For families trying to escape the intense gravity well of poverty, pulling one thread, a babysitter canceling or a bus running late, and a once hopeful situation can unravel very quickly, such as a short-term loss of income, forcing someone behind in rent or credit card payments. But again, we know that many Boston families face poverty, and although poverty alone is a serious concern, it is not why we're here today. For low-income families with sickle cell disease, in addition to the cyclical crises associated with poverty, there is overlaid a second set of destabilizing moments, namely every time the patient with sickle cell disease falls ill. Whenever any family member is sick, let alone hospitalized, everything stops and focuses on the well-being of that family member. For families affected by sickle cell disease, however, these disruptions are frequent and unpredictable. Acknowledging the heightened need arising from this dual vulnerability, many other chronic and serious disease populations have received support ranging from awareness campaigns to assistance with developing and maintaining support and advocacy networks. However, with sickle cell disease, third and fourth layers of vulnerability also exist that have prevented such supports and policies from being put in place. The third layer is what previous speakers have alluded to, that although other groups are affected by sickle cell disease, it has historically been labeled as a, quote, black disease. The related stigma has led to reduced funding and research both from private and public sources, as others have touched on. Finally, the fourth layer has to do with the fact that the primary symptom of sickle cell disease from a social standpoint is debilitating pain. This extreme pain, unfortunately, is a symptom for which there is no test and which often requires high doses of narcotics, drugs that in and of themselves carry stigma, even among some healthcare providers. This additional stigma has led to its own challenges, such as patients with sickle cell disease receiving pain medication on average an hour and 15 minutes later than they should, according to the American Pain Society. The result of all this, from a social legal perspective, is that low-income individuals with sickle cell disease face a perfect storm. They are more likely to experience social and legal challenges than other low-income populations. They are less likely to receive the added support they need to address these heightened challenges, let alone prevent the challenges in the first place. And they are more likely to suffer serious negative health consequences as a result of these problems. This perfect storm of system failures is why this community needs concrete action and support from its government today. Because the need is so high, the potential payoff of action that you decide to take today is high as well. I say this because I know that with the proper supports, individuals with sickle cell disease can thrive. One example of this is a mentee from my college days that I mentioned before, who almost became homeless when her SSI benefits were wrongfully terminated. Excuse me. Fortunately, she had a social worker at Boston Medical Center who learned about the problem. Excuse me. With the help of this social worker, I was able to work with the social worker, with her physician, and with a pro bono attorney, and her benefits were restored and her housing situation stabilized. And now she's in college studying to become a nurse. This story had a happy end, but unfortunately, it has proven to be an exception rather than the norm. Advocates and resources for this population are too few and too far between currently. We need your support today to change that and allow there to be many more happy stories involving individuals with sickle cell disease. Thank you for considering this testimony.
Yeah, thank you so much. I appreciate that, Attorney.
Good afternoon. My name is Laura Taylor, and my 19-year-old daughter, Kelsey Taylor, who is here in the audience today, has sickle cell disease. First, I want to thank, and I'm going to apologize up front if I get emotional, but I want to thank the City Councilor for taking the time today, as well as the members of the panel and everyone who is in the audience. Sickle cell disease needs to be made more people need to know more about sickle cell disease, and I thank you for giving us the opportunity today to talk about it, educate people, and bring awareness to the disease. I was asked to talk today, and Jackie had specifically said, speak from the heart, and just talk about what you, as a parent and a family living with sickle cell disease, experience. And I have to be honest with you, the best testimony of living with sickle cell disease will come from the young people in the audience here today who will get up and speak to you. But I can offer my experience and opinion as a parent. You can probably imagine at 2 weeks old being given the diagnosis that your child has sickle cell disease. I was overwhelmed with sadness and fear that I would not be able to take care of and make sure that she was not only healthy but happy throughout her childhood and adult life. The first response after the tears was to educate myself, to learn any and everything I could possibly learn about sickle cell disease. Unfortunately, back in 1993, the internet wasn't up and running, and even with the internet today, it is very disheartening to continually find the same information from a variety of sources that do not really help you to understand and to be able to medically, educationally, and socially advocate for your child and for your family. I found the same information from a variety of sources that really did not help me. I did not have the opportunity or ability to turn to a support group, an agency, an organization, as other diseases like cancer and cystic fibrosis and other diseases that have much more attention and support in the community. So I focused in on taking care of my daughter and how I could do that best. And I learned that medically, I need to advocate for her. I'm going to give you just a few examples throughout her childhood and young adult life where having this disease has opened my eyes, in many instances, angered me, frustrated me, and brought me to tears, not just for myself, but for other families and other people in the community affected by the disease. When she was 0 to 5, she had lived a, quote, normal life. If you call normal going to the hospital emergency room at 1 o'clock in the morning for a temperature of 101 degrees, or going to the hematologist once a month for blood transfusions and blood tests, et cetera, or having your 3-year-old turn to you and say, "Mommy, why do little kids always have to get ouchies?" and tears streaming down her face. When she asked me one day why her blood was dirty, the reference you made, Dr. Zuckerman, to bad blood, it took me a long time to compose myself and be able to give her an answer that a 3-year-old would understand and that I could accept and understand. She made that reference because she knew every month she was going to get a blood transfusion, which virtually saved her life. So after 5 or around 5.5, she experienced her first acute chest syndrome, which is very, very life-threatening. We had discussions. She did not end up in the ICU, but we had discussions with the hematologist that was on call at the time that she may be in the ICU and on a respirator. That hematologist stood outside of her door with me and told me that although her crit was 19, which is very low, I think an average person is 3840, hers was 19, and that's the number that tells you how many healthy red blood cells are in her system. When the pediatric hematologist told me her crit was 19, and I requested that they give her a blood transfusion, and she told me, no, we're going to treat her asthma, I paused. I said, she's not a child who has asthma. She has sickle cell. Well, we think it's her asthma symptoms that are causing her low SAT, which was only 89. Her O2 SAT was 89. Most people should be 100 or close to that. And the hematocrit that was 19. In less than 24 hours later, and it's because I did not know enough at that point in time to stand up for what I knew was right for my child, she had her first pain crises. Head to toe, she was 5.5 years old. And she was crying and screaming in the room, "Mommy, I promised to be a good girl if they would just stop the pain." From that day forward, I swore to myself and to my daughter that I would never let a doctor tell me what I knew about my child not to be true or the case. We need people, doctors included, residents, nurses, teachers, educators, to understand that we live with this illness, we know our kids, we know how to help them in at least one way. We live with them, we understand them, to respect that and take that into consideration. So she dealt with that on pain meds for a good 11, 12, 14 days. I hesitated to give my daughter morphine at 5.5, but it was the only way to stop her pain. From about 6 until middle school, she was healthy, again, normal. She started, blood transfusions could no longer work for her because of the iron overload. She was told either hydroxyurea or Desferal. She did not want needles every night. We went to the hydroxyurea. We did not know that it wasn't helping my daughter. She was in pain and didn't even understand that she was sickling. So we looked to other ways to alleviate that pain. There were a few programs in the community, one called Kids in the Zone. I think it was sponsored by Harvard. She went to that program and was able to learn other protocol and methods, meditation, yoga, etc. It helped. It was for 10 weeks. After 10 weeks, it was done with, and there were no other resources. She went to Hole in the Wall gang camp to help her be a kid again and really enjoy being a child. So some of those things helped, but they were not the end-all and be-all to the answer. My daughter lives with pain every single day. She's sitting in the audience with pain today, as probably many of these young people are. When she got to puberty, she ran into a situation with the changes in her body, and I really hope she doesn't mind me sharing this, where pain was a constant every day. She was hospitalized for 9 months. There was not one day that she did not have pain in her body. And when I say pain, I know the sickle cell patients don't like this. What's your pain, 0 to 10? Her pain was anywhere from an 8 to a 9 most days. She suffered through that pain. We tried acupuncture, massage therapy, physical therapy, chiropractor, and a therapist. Unfortunately, the pain brought her into a deep, dark hole of depression. My daughter had to see a therapist and be treated for depression. All those things we were able to do for two reasons. I work, I have health insurance, I have supplemental health insurance, and I was able to pay for some of those therapies that were not covered by insurance from my pocket. Sessions for a therapist, $170 an hour, but it worked. It worked to help her get out of that hole and live a more normal life, but I have to say her quality of life is one that suffers. The educational system needs a lot of help and education with this disease. For anyone, and now she's in college, on the college level, to compare this illness to mono really is disturbing to me. I don't understand that they can't equate, and maybe it's our fault for not educating folks enough and putting the word out there, but we have to do a better job. In the public school system, the examples you gave, my daughter was reprimanded for wanting a water bottle in class and then having to use the bathroom. Running the mile, which is a part of PE requirements, we had to literally spend hours explaining to folks and doctors coming in and doctor's notes that my daughter will not and cannot do that. The educational system does not see our children as children who have needs because they look good. I think my daughter is beautiful. All these kids in here are amazingly handsome and beautiful. They do not have hair falling out or puffiness from steroids. It's pretty much a silent disease. You wouldn't be able to tell that half of them are in the pain that they're in 24 hours, or mostly 24 hours a day. So we need to educate the public school system, the private school system, the secondary school system. She is now struggling in college to help her professors and deans understand what she goes through every day. When a child goes into the hospital for 2 or 3 days on pain meds, they come out and they're weaning off of those pain meds for another 2 or 3 days. So they can't do their homework. They can't finish that paper. People need to understand that, and that's where we need to educate folks. And then resources, social and community resources. Families do suffer. I have an older daughter who, God love her, I know got lost in the sauce while we were dealing with our younger daughter. There needs to be support systems for not just the patient, but the family as well. My oldest daughter, I did not know this till a teacher told me, thought that every time, she was 7 at the time, but every time her sister went into the hospital, she thought she was going to die. I didn't even realize that. So there's a need for the patient to receive services, the siblings, and the family as a whole. I was a little I don't know what the word I should use because I love my hematologist in the hospital that my daughter is seen at, but the social worker and the child care advocate or services, they focus on the patients who have cancer. They don't focus on the patients who have sickle cell or other blood disorders. There was a parent liaison who recently retired, but she only was a parent liaison for cancer. She and I had many conversations at night when Kelsey was in the hospital about the need to have a parent liaison in each hospital that specializes in sickle cell anemia. It's a different type of disease. She told me she couldn't relate to me or help me. Her child had cancer, that's why she was, and her child's now an adult, but her child had cancer, that's why she was the parent liaison. All of these things get overlooked so easily and so frequently because people are not educated. We need to get the word out there. We need to provide services and organize. We need a continuum of care. It's not just the blood transfusions, the hydroxyurea, it's the educational support and care, it's the social services and community services. So I think I have said enough. One last thing. Yes. I'm sorry. Many people in this room, when you were speaking, I don't know if you saw it, but the statistics you told me about either made me angry or made me sad. And one thing that Kelsey and I have not talked about, maybe once or twice in her entire lifetime, is her life expectancy. She has, and all of these young people in this room have amazing dreams, goals, aspirations, and they should have the opportunity to reach those within a normal lifespan. I was told when Kelsey was born that there'd be a cure at age 5. Then I was told there'd be a cure at age 10. After 10, they knew not to come back to me and tell me there was going to be a cure at age 15 because I didn't believe them. I knew that that wasn't going to happen. There are too many resources, and Dr. Spritz said it. We are this close to finding a cure for sickle cell anemia. There is no reason under the sun that there should not be a cure now. And my daughter has the right to finish college, become a doctor, travel the world to advocate for sickle cell anemia, which is what she wants to do. And unless more attention is paid to this disease, I'm afraid that that wouldn't happen. And there are so many amazing young people in this room that have a lot to give back, but they need the opportunity to give back. So please, thank you for your help, and we appreciate your support.
Of course, that was powerful testimony, and I will ensure that every one of my colleagues and the mayor has the opportunity to view that testimony. Because I agree with everyone who has spoken so far that society as a whole has to accept some responsibility for the lack of focus, lack of attention, hate to say this, but even indifference with regards to this disease. So maybe today is the day we start to turn that around. So at this time, I'd like to hear from my friend Jason, who's a board member. If you can reintroduce yourself and offer your brief testimony at this time.
Absolutely. Thank you. Thank you, Councilor Yancey and panel members for giving some very powerful testimony. Good afternoon. My name is Jason Calianos. I am on the board of the Greater Boston Sickle Cell Disease Association, and I'm the owner of Calianos Insurance, a family-run insurance agency that has been serving the Roxbury community since 1955. I took over the agency in 1989. During my time in this community, I've forged some very special relationships with my clients. Many have become good friends. I've had the pleasure to attend weddings, children's birthdays, and graduation ceremonies. I've also had to attend funerals, and I had to even drive parents to the hospital when kids were sick, all from a little small insurance agency in Roxbury. In short, I've had the opportunity, the wonderful opportunity, to know my clients in many faceted ways. I have seen them at their best, and I have seen them at their worst. In fact, some of my clients have been members of my agency longer than I have been living. Talk about the customer's always right. During my time in this community, I have never heard anyone mention the term sickle cell anemia, not once. In fact, I thought it was a disease that was eradicated years ago. When I was made aware of this organization, I started talking to my clients. I started talking to my friends. And it turned out many of them had or were affected by sickle cell anemia. This struck a chord with me. I was astonished at my own lack of awareness and the lack of awareness of my state. I got involved with the organization and I learned a lot more, and there's a whole lot more to learn. But one thing that I am in awe of, I am in awe of the absolute dedication of this organization. I am in awe of the absolute selflessness of the people of this organization. The few truly carry the torch for the many. It is time that we have help with this task, though, Counselor. Funding and awareness are needed to bring this issue to the forefront. I would ask, through this testimony of everyone here, that we help stop the silence. Thank you very much.
Thank you very much, and thank you for your commitment as well. We're going to open it up to others wishing to testify. I ask those who... Okay. When I call your name, if you can come and stand behind this podium. Lincoln, can we set up a second podium as well? Okay. And I ask that you keep your remarks to 1 minute if you can, but certainly no more than 3 minutes. We want to hear as many people as possible. Now, some of you may have signed the list without wishing to testify. That's fine. But I will call your name, and if you care to testify, simply come down. If not, you can stay where you are. First name on this list is Kelsey Taylor. If you wish to testify, please come down. I assume you're related to Miss Laura Taylor, but I'll let you tell the story.
Was the wonderful woman who spoke 2 minutes ago.
And you're almost as beautiful as your mother is.
Thank you. She said a lot of things that I was actually going to say, so I will keep my remarks brief. I woke up this morning by a phone call by my mom, and as soon as I woke up, I felt every ache and every muscle compressed in my body. I rolled over and I answered the phone, and she asked me if I wanted to speak today. And I said, "What do you think? I'm not feeling that well. Should I go?" And she said, "I think you should go." I wanted to tell you that brief story because that is basically my everyday struggle. I wake up in pain. I have to remember all of the things that I have to do, and I have to ask myself, can I do them today? I just want everyone to know that the struggle of pain that I have inside of me all the time is not my biggest journey. My biggest journey is going out into the outside world and having to advocate for the things that I don't feel that I need to advocate for. Having this illness, it's hard because it's invisible. I stand in front of you today, and you may not know that I took pain medication, that I am in pain and am sick and not feeling well. And just by looking at me, you have no idea. I think this is the biggest problem of this illness, and it's a struggle every day to fight for my education, to fight for my dreams, to go into a world of people that don't understand that I have a chronic illness, that I too am an individual, and I just think that it's very important to educate everyone because it's hard to want to go out into a world that I don't feel respects my needs and all the things that I have to go through. And like my mom said, I woke up today not feeling as sad as I usually do, but I do struggle with depression because it's so hard every single day to be in this pain. And I don't understand why people aren't more aware of this illness, and I wish that that wasn't an everyday struggle that I have to deal with. So thank you.
Well, we thank you for your courage and your commitment and your willingness to join us today, even in your pain.
Thank you.
And I don't think I'm exaggerating if I say we do love you and thank you, and wish to give you some encouragement and strength as well.
Thank you very much.
I also have Annette Taylor from 151 Washington Street in Cambridge, if you could join us. Incidentally, folks, I have suspended the rule which says I would not allow expression of support or opposition. You can applaud if you like when the spirit moves you. I should have told you that earlier. I would have been in violation of the City Council rules, but I'm going to relax that at this time. Yes, Ms. Taylor.
Hi, my name is Annette Taylor, and I'm from Cambridge, Massachusetts, originally from Jamaica, and I'm not related to Kelsey. We just happen to have the same name.
It's a coincidence. I have 3 Taylors here.
And I would just like to read my testimony. 23 years ago, my brother Charlton died from sickle cell disease. Every day I think about him and what his life might have become. I know that he wanted to be a chef. He graduated from Cambridge Ranger Latin High School, but he never got the chance to go to college or become that chef. When we were little, they said he wouldn't live past 10 years old. And when he did, I thought, oh, good, now he can have a normal life. But there was nothing normal about being in pain all the time from one crisis after another. He was constantly struggling with pain. The worst part for me was there was nothing that I could do to help him. So I just sat there and I watched, and I felt sorry for him because there was nothing I could do. I remember the last crisis my brother had, and I remember it like it just happened yesterday. It was January 1990, and he was brought to Cambridge City Hospital. He was 19 years old. The saddest part was we took it lightly because he was always going to the hospital, spending a day or two, and then coming home. So we thought nothing of it, but not this time. He needed a blood transfusion again. They couldn't get a line because all his veins were collapsed from always being poked with needles. And when they did finally get a line, his body rejected the blood. That was the moment that I broke down and cried. I felt within my spirit that my brother was not coming back from this one. It was the most graphic thing I had ever seen in my life at that point. When all the blood was coming from his mouth, from his nose, from his ears, just everywhere, there was just blood. The doctors, the nurses were trying to keep me from going to the room, but it was too late. I had already seen it. When he was well enough to be moved, at least we thought he was well enough to be moved, they took him to Boston Children's Hospital, and that's where he stayed until he died on March 31st, 1990. He died on my youngest brother's birthday. My youngest brother had just turned 2. They had never met. Like I said, we're from Jamaica. Every birthday for my baby brother is bittersweet for me because what I remember is that this was the day my brother died. He was 19 years old and 1 month away from his 20th birthday, which would have been May 1st. He never made it. Thank you for listening to my story.
Thank you very much. Thank you very much. So I'd like to ask Kadeem Gale to come to the podium, and after him, Dima Hendricks, if Dima can take the podium to your left and my right. And Lillian McMahon. Is Lillian in the audience? And I see Tegila. I'm sorry, I'm mispronouncing. I can't quite make out your first name.
Beatrice.
Beatrice. Oh, thank you. Is Beatrice here? Okay. If you could stand behind Kadeem, we'll alternate. And after Beatrice, Barry, pronounce your last name for me. Where's Barry? Barry, not here? Okay. Helen Sapong. Helen here. Charles Howie. I'm sure that's not your last name. Oh, Charles. That's Charles Homer. I'm sorry. That's Dr. Charles Homer, who's already testified. All right. Very good. So at this time, we'll begin with my friend Kadeem.
Hi, my name is Kadeem. I have sickle cell thalassemia. One of the ways that I find best to cope with sickle cell is by writing, and I'm going to read what I wrote.
Okay.
Throughout the years, my life has been like a lab rat. See, I was born with sickle cell, and my hematologist put me up through these dramatic tests just to see if my inside organs still function. I lost respect for myself because of these crescent-shaped cells, though some say I'm rebellious because I take too much drugs, but I say I can't help it. My body is literally putting me through hell. I'm not gonna lie, those liquid forms of drugs held my crisis, running through my veins, then dancing on my spine. It's like it's too pure to be unclean, but it's obviously why they call it morphine, because no doubt about it, the more you receive, the more you glean. Pain is my food, it gives me the energy to live. But then consuming these pills just say I need help to live. In 2008, I was forced to drop out of school, not because of the financial recession, but my body felt like it was going through the 1930s, the Great Depression. Living with this disease, what's the point of trying to succeed? It's like I'm drowning in life, and all I want to do is breathe. I'm tired of these countless nights where I wake up and I can't walk. How can a cell these big feel like I've been stoned by rocks? And in the winter, I'm being forced to wear armor, and my armor is not exactly made out of metal. It's made out of pajamas worn underneath my clothes to protect me from the cold. And you may think pain is the only side effect for this disease. Try pancreatitis, pneumonia, and gallbladder removal. And these side effects, they're accidental. They don't come with any fine print label. But bloodstained on my ambition, I give up to lose. I may be born without a dream, but every day I'm living to succeed. So yeah, that's just a piece I wrote, and writing is the best way that I cope with sickle cell. And one thing I find it hard is like being in school, like especially being in college, and I feel like when you live with sickle cell, you should still be able to live your life. In 2007, I went to Florida and began my college dream, but I was sick like almost every 2 weeks in the hospital. And then I was forced to, I had to leave, and I had to start all over again in 2008. And I feel like if there could be any support for the education system, that'll be very good. And I'm done.
Well, thank you very much for your testimony. Dima? Yes.
Stoughton, Massachusetts.
Welcome.
And I used to be a board member of the Greater Boston Sickle Cell Disease Association, and currently I am the executive director of Miss Black U.S. Ambassador. Today is a bittersweet day for me. I was told I would not make it to 18, and I just celebrated my 31st birthday. So I just wanted to thank God for that. I was diagnosed with sickle cell at the age of 6 months old, and my mother was my advocate. However, she passed away when I was 12 years old, and very early on I had to begin advocating for myself. I was told I had gallbladder disease, I had acute chest syndrome, and as a matter of fact, there was a point in time I had it every year. I had blindness in one eye, I've had a stroke, I've had the whole nine. But I'm here today, and I'm here today for 3 reasons. My faith in God. Every morning I wake up and I determine and I know that by his stripes I'm healed, and I continue to read that scripture in my mind. I also am here because of my doctor, my hematologist, who's here today, who's Dr. Lillian McMahon. I thank her so much. She's been my hematologist since I was 6 months old, and I was so thankful to transition and to have her now that I'm 31. I went to different hospitals, and one hospital told me that I had mono, when I knew very well I had acute chest syndrome. So with that said, I think a lot of the doctors, not only in the Boston area, but in the affiliate hospitals, need to understand that sickle cell is a real disease. We don't have bad blood. We don't have mono. We're not contagious. And I think that's something that needs to be just highlighted. I've also had a lot of setbacks in education. Right now, I'm currently still trying to get my master's degree in expressive therapy. And I just recently, I think it was like last month, I called Jackie because I needed help trying to advocate with a professor who said that my work wasn't on time and she didn't care that I was in the hospital. It needed to be on time in a certain amount of time. And the Greater Boston Sickle Cell Disease Association was there to help me through that experience. I appreciate you guys for what you do.
Thank you.
So thank you so much for that. And I just wanted to say that all the speakers here today did such a good job of presenting and alluding to different facts about sickle cell, but we also need to concentrate on the mental health aspect that is associated with sickle cell disease. I've suffered from depression. You've heard Kelsey's testimony. She suffered from depression. But know that the faith, I'm glad that I saw Reverend Borders here today, because the faith component is an excellent way, and even Pastor Stevens is an excellent way to get us motivated and get us healed. So I thank you for your time.
Well, thank you for your testimony. Thank you. So our next testimony is from
Beatrice.
Beatrice,
Tagia.
okay. Beatrice, pronounce your last name for me.
Tagia.
Tagia, okay, thank you.
Good afternoon, City Councilor Yancey, and thank you very much for providing us with this opportunity. I want to thank the panelists and doctors and people affected by the disease. Thank you very much for advocating for people like myself. I grew up in Brighton, Massachusetts. I moved to this country from Cameroon in Central Africa, and I knew that I had sickle cell disease when I moved here, but I didn't have the resources like I do now have today to manage my disease. I was diagnosed with this disease at 3 months of age by an American doctor who was a missionary in Cameroon. I want to start by thanking my immediate family who's here with me as my support system. I want to thank my husband, Joseph, who's in the audience. I want to thank my mom, Rose, who happens to be a medical professional. And I want to thank my spiritual counselor, Lisa, who's here with me and prays with me. And you've heard from Dima and talk about the faith aspect of just helping us manage our disease. I just wrote a piece to kind of summarize where I'm coming from. And the background of this is the socioeconomic aspects and the effects of sickle cell disease. Dima also mentioned something about her education. I wanted to start by saying that I matriculated at Bowdoin College in Brunswick, Maine, but because of the population demographics in Maine and not having too many African Americans and then people with sickle cell disease in the area, I didn't have the medical help and care that I needed in Bowdoin, Maine, in Brunswick, Maine. And so I had to transfer and continue my education at the University of Massachusetts in Amherst, where I was seen at Bay State Hospital for some time. And before that, I also was taken care of by Dr. Leland McMahon, and I want to thank her for her dedication and compassion with people with my disease. And because I started a family, I had to move over to the Brigham and Women's Hospital in Dana-Farber for adult care. So I'm also a 31-year-old professional wife, mother of two very adorable boys who have sickle cell trait, and I have to educate them about this disease. We've all heard about, the importance of knowing about having the trait. Unlike the general outcome of people with this disease, I belong to a fortunate group of individuals who've attained some major milestones in life, including completing college education, purchasing a home, and being able to keep a stable job since obtaining my bachelor's degree in political science. I would also love to start a master's program in advocacy if I had the opportunity to further my educational aspirations. I attribute my success to a number of aspects in my life, of which the love and support of my family have been particularly remarkable. I've also learned to manage my disease through health-conscious efforts pertaining to advances in medical treatment, proper diet, as well as regular exercise. Perhaps the most important factor which has contributed so far in managing my disease is through community involvement that has significantly favored my ability to conquer this dismal nature of its effect. So far, there are a disturbing proportion of patients who have been unfavorably victimized by this disease in the Boston area. We have observed that generally they lack a cohesive and structural unit in their lives, such as nurturing family members and community integration. Therefore, it is our effort to advocate for a more effective communal support and state involvement. In addition, those affected by this disease do not have to solely rely on a support system that is non-existent in dysfunctional homes. As mentioned in the hearing, many people suffering from this disease have a short life expectancy. I just want to interrupt this. I did just come back from a funeral last weekend for the son of a prominent hematologist who happens to come from Ghana, who lost his son at 41 years old to sickle cell disease in Philadelphia. So I was just at a funeral last weekend. Last year, I was at another funeral for Bobby Vines, who was a very active member of this community and suffered from sickle cell disease, and he too died at 40 years old. So this is something that we have to deal with every day and live through this. Those affected by this disease do not solely have to rely on a support system that is non-existent in dysfunctional homes. And many people suffering from this disease have a short life expectancy unless their complications are prevented with the right resources. Providing these resources will also aid in allowing people with this disease to be better members and contributors of society. My mother happens to be a registered nurse with a master's degree in public health. She works at the Brigham and Women's Hospital in Boston at the Center for Women and Newborn. She cares for high-risk pregnant women. She has come in contact with many young women that are suffering from sickle cell disease, some of whom are poorly educated on how to manage their illness. Many of these young women have numerous hospitalizations during their pregnancies. They present with severe complications of the disease and often need admissions. They lack an adequate educational support system to teach them on how to take care of themselves and prevent frequent hospitalization crises. Moreover, these women are on several medications that are dangerous to the unborn fetus. A major component of these is their shortcomings in knowledge and care results from the lack of sufficient funding. Despite all of my progress so far, I have ambitions to further advance my career, but I have not found a good support network of professionals to guide and motivate me to reach my highest potentials. And I echo the same scenarios and examples of just being at work and not being able to eat in my desk or have juice or water or anything like that. So these are things that we have to deal with, and people don't know the pain that we go through internally. Let's see. Okay, so I have not found a good support network of professionals to guide and motivate me to reach my highest potentials. With the help and involvement of the state of Massachusetts legislators, city councilors, to advocate for provision of resources and services available to people with sickle cell disease, many of the individuals suffering from sickle cell will be in a better position to reach their maximum potential and experience a better quality of life, including longevity. We need more tools necessary to equip us to manage this chronic disease with the hopes of finding a cure in the near future. We want to be effective and play even more roles as members of society and not just people who are considered disabled or on disability. We are requesting for a more resonant awareness of this disease in the public schools, state and federal sectors, as well as private companies in the Boston area. People with sickle cell disease need more encouragement to help them feel less like isolated statistics and more like integrated contributors of society. Finally, there is a common public opinion on people with this disease to be stereotyped as drug seekers. However, not enough is done to assist those patients without family support and support from the community to figure out ways of preventing pain episodes and keeping away from the hospital. We need to establish programs in places sponsored and recognized by the city that would decrease the frequency of hospital visits and occurrences of complications. Many other organizations that advocate for people with diseases such as autism, cystic fibrosis, breast cancer, diabetes, hemophilia have structured programs in place that are well funded to help these sufferers better cope with their disease. We want to break this silence and lack of attention to sickle cell disease by introducing resources that will empower us and also offer valuable education to the general public on sickle cell. Thank you.
Thank you so much, Ms. I'd like to invite Wilhelmina Skrine to join us, and Deborah Francis Jacob, Michael Jacob, and George Corbin, if you're still here. And again, we have two podiums. Again, I ask if you could limit your testimony so we can hear from as many people as possible. Ms. Skrine, you can come down as well. Okay, and again, another podium to your left and my right. Hey, Miss Jacobs?
No, Helen Sarpong.
Helen, oh, I thought I called you earlier. You didn't respond. Okay, okay. Please reintroduce yourself. And
my name is Helen Sarpong. I'm 38 years old, and I have sickle cell disease. I just want to thank everyone for inviting me and everyone else here. I'm a little bit nervous, but I'll try to get it out. I'm 38 years old. I've been waiting for this day my whole life, so I'm very happy to be here. I'm a mother of twin girls, and to the great work at Boston Medical and Dr. Linya McMahon, I was able to have my girls. They are 4 years old, and they have sickle cell trait. So I am here to pretty much talk about advocacy for myself, the importance of patients fighting for themselves, and education of the patients. I spend my time, I'm going to try not to talk about my experiences, but I will say that it is one that's been a long journey for me. Like Laura and her beautiful daughter, I've had pretty much the same kind of road. I was told, my mother was told from a young age that I was not going to live. Every year I feared my birthday. Never thought I would be here. I turned 38 last week. It was a big deal for me. My father is 68 years old, and he also has sickle cell disease. And I'm surprised that he's still here, so I'm hoping that I will follow in his genes. I was able to graduate college with some difficulty, but I did do it. And I heard Annette's story of her brother, and I'm a pastry chef. I graduated from the Culinary School of America. And unfortunately, 5 years ago, I was diagnosed with having problems with my hips, needing to have my hips removed. So I had to quit the career that I loved so much and fought so hard for. I spend my time going out, traveling, talking about sickle cell disease, and showing the world a face, and that we do look normal. You know, our pain is inside. I'm in pain right now, just to be honest. But I'm hopeful. I'm so hopeful that their cure is coming. I never thought it would take this long. And I hope that by the time that my daughters who have the trait are my age would not have to think of sickle cell disease, would not have to worry about their partner that they choose to marry or have children with if sickle cell is a factor because they are carriers of the trait. Like I say, so I travel talking to pharmaceutical companies to make them understand the importance of drug trials for individuals with sickle cell disease, and that we're not cancer patients. We cannot all be grouped in the same arena. Yes. I've spent many times in the hematologist's office where everyone thought I had cancer, or they felt sorry for me because they thought I had cancer, but I had all of my hair. That does not make me feel good. That does not make the population feel good. We want to be a part of society. We want to graduate. We want to pay our taxes. We want to live a full and long life. But in order for that to happen, we need the advocacy work. We need the resources. We need a support system. You know, the hardest thing about having this illness isn't the disease itself, is the compassion, the lack of compassion, is the fact that you can lose your job because you have an illness, the fact that you cannot get health insurance or a life insurance, you can't even protect your family. Those things make it difficult every day. You know, the pain, yes, we have to live with, but if there was more compassion, if there was more resources, maybe when you wake up in the morning, it wouldn't be so bad. You know, if we felt like someone really did care. I don't think that sickle cell, for me personally, is a race issue or something that we check in a box. I really, really feel like it's about being compassionate human beings, because we all bleed the same at the end of the day. You know, like Laura's daughter, I spent the rest of my whole life thinking that my blood was bad. I come from Ghana, West Africa, and, I spent many times in a room where people did not want to interact with me because they thought my blood was bad. Yes. I no longer feel that way, but it is kind of there deep down inside me. And I would like to wake up one day and not have to have those kind of horrible memories. So I'm encouraged, and I'm just so happy to be here, and just want to empower all of the kids who are here and who want to have an education, you can do it. It may take you a little bit longer. It took me 4 years just to finish a 2-year program because of my illness and the complications that went along with it. But I choose to spend my time being happy and helping others and teaching them to be their own advocates and to make them understand that, you really can do everything, that you just have to aim big and you can do it, and tell the truth. If it hurts, it hurts. You cannot please everyone but yourselves. You cannot, and you have to fight for yourself. But in order for that to happen, we have to speak up. We have to speak up about sickle cell disease because there is no reason why in this present day and time that you do not see a commercial or an ad or a billboard or a spokesperson talking about sickle cell disease. For me personally, if I woke up tomorrow and put on the news and had a Angelina Jolie talk about sickle cell disease, I don't even know what I would do with myself. It would just uplift me. And I think that's what we want. Right. We want to be heard. We want to feel like we matter. I matter.
Yes.
And that's what's most important. I matter. I want to be here. I want to have a long life to raise my daughters. I never thought I would be a mother, and I am to this day. And it's because I've had great support system, Boston Medical, and young man over there, and just you all today. So thank you for having me.
I just have one word. This is a problem. Before I let you go, I just have one word for you. Listen to me. Akwaba.
That's it.
All right. I spent some time in Ghana. That simply means welcome. This is your place as well. Thank you so much.
Thank you.
So at this time, Wilhelmina Squine, and then we'll hear from Mr. Jacobs.
Hello. It's very nice to be here. I'm a mother of 3. 2 are full-blown sickle cell anemia. I learned about sickle cell in 1956. And I lost all my children. The last one will be 7 years this November. So we need a cure for this disease. I live with it every day. I'm 76 years old, and I have no kids. So we really need a cure for this disease. Whatever we can do it, please, because I live every day. I miss my children very much. I don't have any. So, please, do whatever you can do. We need it bad.
Thank you. Thank you so much. Mr. Jacob and Deborah Francis Jacob. There's George Corbin. Oh, you're George, okay. Please introduce yourself and offer your testimony.
Good evening.
Good evening.
My name is Deborah Jacob, and this is my son, Michael Jacob. Michael is 17 years old, and at 2 weeks old, Michael was diagnosed with sickle cell anemia. Since then, Michael has had more than 100 hospitalizations, from pain crises to acute chest syndrome to just fevers. He has been treated with antibiotics and many different pain medication. Majority of the pain medication right now, the narcotics, Michael is allergic to. So he have a limited amount of pain medication he can be treated with. We had a situation 2 weeks ago where he got sick, was taken to the hospital by one of his older brothers, because I was at work. And he was sent home after being treated in the ER. By overnight, the pain really got so bad that the next morning I had to take him back to the hospital. And it took them a while before they were able to control the pain at that point because it was gone real bad. The situation that Michael and I had, and Michael has 2 older brothers who helps out a lot. When he was younger, he was hospitalized so many times. As a small business owner at the time, I had to sell my business and go back to school to be an LPN nurse. And while I was in school, Michael was being supported with SSI. As soon as I finished school, within a year, Michael was denied SSI, and I was told that I had to pay back over $11,000. At that point, he was getting supplemental health insurance, and at that point, they also told me I was making too much money as an LPN nurse, supporting my family, and I had at that point got health insurance through my job. The challenges right now, I've been trying to get Michael back on supplemental health insurance, but I was sent a letter about a month ago that he was approved. However, I have to pay $11,000 in premium. Speaking about Michael, he woke up this morning and he was in pain. So as you can see, he's walking with crutches right now. And it's very hard, taking care of a child with sickle cell. And I did not want to come up here and say anything because the testimony of Ms. Taylor covered majority of what Michael and I went through. And, I really do appreciate that, City Councilor, that you take the time to allow this. I've been a member of the Sickle Cell Organization since Michael was 2 years old. Michael is now 17. And, for it to come to this, it makes me feel so proud that I took the evening off from work just to be here.
Thank you.
And I really do appreciate your help. And hopefully we will get something out of this.
Thank you very much. Michael, did you want to say anything?
Thank
you. Michael, I'm 17 years old, and today I woke up and I was just having pain in my legs and my arms and stuff, and it's very hard living with sickle cell. Like, sometimes in the middle of the night you get up with pain and stuff, and then you still have to get up and go to school, and you barely have any sleep or anything like that, and then you miss days from school, and it's it's not just depressing, but it's also a little bit stressful because you got to make up all the work by a certain deadline to pass and go to next grade and stuff, and every time you see friends just coming up to you oh, where have you been, and you gotta try to explain to them because they don't really know nothing about sickle cell disease like that, and it's hard just living with it and stuff.
Well, let me say this, Michael. I've been a member of the Boston City Council for 30 years, and I'm not going to be here forever.
Yeah.
Would love it if you can take my seat on the City Council. Thank you so much for your testimony and your courage and your ability to work through your pain to contribute to others. Thank you very much.
Thank you.
My friend George Corbin. Oh, please come on.
Good evening, good afternoon, all. This is a privilege for me to be here as a parent. I'm a resident of Boston. My name is, as you said, George Corbin. I represent my family, and more specifically my daughter, who is the one in the family who has the disease. Her name is Kara. She's a 16-year-old, just turned 16 this past May. She was first diagnosed at age of a year and a half. She was actually born in Nigeria. I spent a good number of years there. Her mom is from there. My heritage is also from other lands as well, from Barbados. But at 13 years old here in Boston, I was told about my caring trait, and I never thought much of it. At that age, Roxbury Comprehensive Center, and it's only now that I realized that this is something that I probably had been prepared for a little long before now, and didn't realize as it stands. But anyway, her first pain crisis came around when she was about 2 years old. So Karis is actually one of the lucky ones, to be honest with you, because as I witnessed here today, there are other families who are much more severely affected by this. She's probably would have had a little bit more hospital visits if I was attended to. I've been recommended by Dr. Sprint and others not taking her to the hospital at a 101 temp. She's had that many a times, but she has been through probably a crisis like once or so each year. Some more severe, which required transfusions. Some require hospitalizations. It's really painful as a parent to see your child.
Yes.
In agony, yeah, without being able to do anything about it. I'm grateful, though, for the great medical treatment she's been able to receive at Boston Medical.
Oh.
Anyway, it's one of the things that has been challenging is her school. In her elementary school time at the Mather, as she was attending, it was very difficult to inform and educate the administration about her condition. Having to be wearing sweaters just about from September all the way to this time of year, just to be staying warm for her own protection, not being able to go on ski trips or other outdoor trips as a result of her concern. It has been very difficult. I know for a number of years we had to do a lot of gymnastics with her getting an individual educational plan, IEP. She has another condition, actually. She's ADD as well. Several times we, and her counselors, in her annual review, we had to find ways of going around policy which didn't quite contain the condition of sickle cell to give the provisions and the accommodations. At this time, it's much better. So I have to say that over the last few years, it's really improved on her school condition. At age 7, 8, she had a very severe pain crisis, which caused her to be hospitalized for more than 2 weeks, about 3 weeks in school. Had transfusions, had a number of different treatments to be done. I reluctantly, I'm one of those parents that don't like to be over-medicated, so I reluctantly had morphine and all the other more intense drugs for her pain to be administered. All those things had to be done. She eventually went back to school. Well, before that, we requested tutoring services, which was delayed while she's in the hospital. Eventually, we got them, and they weren't adequate. Didn't quite do what to keep her on track. Missed over about 3 weeks of school. That year, she was in second grade then. She had to repeat that year because of her being out of school. Karis is looking to enter high school now. So she's actually, because of the challenges in her education and other things, is about probably 2 years behind a normal student because of her entering high school now this September at 16. But all the while, she's a very happy student and trying her best with her conditions. We've had good supports through other programs, summer programs, so Hole in the Wall Gang Camp, I heard it mentioned here today, other things like that. Now being 16, that's definitely out of the question. So there's been concern for how to support her now as an older teen, and the different support services that can be there for her as she enters high school next year. I'm just seeking your support, and we have it already, so I just want to say commend you for the support being given. I'm glad for all those who have spoken today, especially the young men and women who are here who have spoken for themselves and kind of enlightened me of their own daily challenges and what they're able to do to overcome them. So I'm grateful for it.
Well, thank you, Mr. Corbin. Please give our best to your daughter as well.
Okay, thank you.
Thank you so much. Okay, folks, you've been fantastic. And I'm really grateful that all of you took time out of your valuable schedule to be with us. There are 3 other individuals who I have listed who wish to testify. I ask that they keep the testimony to a minute or less if you can. And after that, we will adjourn the hearing. So I'm looking for, looks like Maisha Demery, if you can join us, Carolyn Nunez, and Lynn, it looks like Lenny Reed. If is anyone else interested in testifying? I may not have your name on this list. Okay. Why don't you come and stand by the podium as well? And again, we're really just scratching the surface. This is a beginning of an effort that I will work hard to ensure that your city government is responding to these issues and encouraging other levels of government to increase their commitment by way of resources and education. So I guess we'll start to my right and your left. And
good evening.
Yes.
Thank you, Councilman Yancey, for holding this hearing and hearing such impassioned pleas from parents.
I'm going to ask you to introduce yourself.
I'm so sorry. I'm my daughter, Maisha Demery,
yes,
who signed the list to testify, is not able to do that because here's the first rule of education for this office.
Yes.
As she sat in here for over 2 hours, she's gotten cold and she's now suffering from chest pain.
Okay.
So she was not able to come down to testify. So my name is Peggy Pickering. My daughter, I'm grateful to say, I always have to ask how old is she? Because I was told she would die at 21. You 35 or 36? 36 years old.
Oh, thank God. Yeah.
I don't have to remember, but I'm grateful that she is 36. I want to thank Dr. McMahon, who I met when we first moved here, Dr. Zuckerman, who has been in our corner for a very long time. Forgive me, I'm nervous, names are losing me. Reverend Stevens, for being on the side of persons with sickle cell disease. And I know as a community person that you have been there also. I'm going to try to be brief. Maisha has, in 36 years, lived all of everything that you've heard today. I knew when she was 8 days old that she was going to be living with sickle cell disease. She had, from the very inception, hand-foot syndrome, many bouts of hand-foot syndrome, which is where your hands and your feet swell and are very extremely painful. They are red, they're swollen, they're painful. She had to learn to walk several times because of that syndrome. But she made it. She's a fighter, as are many people with sickle cell disease. They get knocked down, but they get back up. They persevere and they keep on going. And all we need as parents and supporters of people living with sickle cell disease are more impassioned doctors, more people who take the time to hear, understand, listen, research, find ways to get money to throw at this disorder, to throw at every level of this disorder. Boston Medical Center started a program that was useful in helping people, especially adults with sickle cell disease, stay out of the hospital, and it was called a day clinic. At the day clinic, someone who was in pain could call up, see if there was an available bed. There are very few. But see if there was an available bed and go in and get medication and fluids, 2 things that would help them to get over that hump and to get back out, to go back to school, to go back to work. When Boston Medical lost funding, they also lost the day clinic for people living with sickle cell disorder. At least that's my understanding. I just know it's not there. And instead of Maisha being able to go to the day clinic, she has to go to the emergency room. And the emergency room is often, for an adult person living with sickle cell disease, not such a pleasant experience as you've heard. The wait time for medication is not necessarily all that great. And I just want to say, I don't know who thought about it, but starting the IV pumps in the emergency room, like you're currently doing right now, was brilliant. Just brilliant. Because once you left the emergency room and you made it to the floor, you had to wait oftentimes, maybe hours before you can get medication. So, brilliant. I could go on and on and on, but I just want to say that in that you've started down this journey, and you're going to take the rest of the council with you.
Yes, and the mayor's office too.
And the mayor's office. You have supporters.
Whoever happens to be mayor next year.
Absolutely, we're there. We want to step through that door with you in the beginning. But thank you for this journey that you're about to embark on.
Thank you very much.
Hi, my name is Carolina Nunez. I am the mother of Kyra, who's 5 years old. I would paint a gloomy picture of her, but she is so alive. She is so playful. She's so girly. And after 3 boys, I am so grateful.
Excuse me, you have 3 sons, and then your daughter was born after your 3 sons?
Yeah.
It sounds like my family. We have 3 sons. 10 years after our 3rd son was born, we had a little girl. And she's the apple of my eye.
You're happy now, right?
Yes, I am.
You know, she has sickle cell, and she wants to do things. She wants to be in ballet class. She wants to play soccer. It's raining, and she, you know, struggles. I try to be as supportive as I can in helping her achieve what she wants. You know, it is very difficult. In the community, she wants to go to a pool. I can't find pools that are 82 degrees, or, you know, there's a birthday party in places like, you know, that have water. It's just really hard for me to, you know, to have the places, the supports in the community. I'm struggling with the school. It is now June, and she has missed 45 days of school because they refused to give her ibuprofen. You know, it's really emotional for me because I feel like I have to fight all the time. I feel disrespected that woman lost her 4 kids, and we're still here. And things have to change.
Yes.
You have to value her life, our lives, in the same way that others are valued. And that's all.
Well, God bless you. Thank you so much. And I believe this is the last person testifying. Let me ask. Oh, no, I'm sorry. Step up to the podium, please. Okay.
They can go first because they signed up. I didn't.
It's okay. I'm sorry. Okay.
No, okay.
You're too polite. Please, while we start off, and then we'll come. Thank you so much. Thank you so much. Yes.
Charlie, Barry, Philippa, Yancy, Charles Yancy.
Yes.
How are you doing, Pastor Ron?
Doing well, thanks.
Good.
Good to see you.
Good to see you as well. It's been a long journey.
I'm going to ask you to mention your name for the record. This is still an official hearing of the City Council, so when people view this, they know who's speaking. So, yes.
Sure. So my name is Lenny Reed, and this is my daughter,
Damali Reed.
Damali. All right.
And I am extremely grateful to be able to come here today to address the council, and I am grateful to hear from everyone here in the audience about some of the things that they've found helpful in overcoming and some of the challenges that are faced with this disease. And at the same time, I feel hurt and disheartened to hear that the suffering. I wrote something. So I'm an advocate for patients and families, not just with sickle cell disease, but I think for patients and families for children living with all types of healthcare diseases, but specifically my passion is with sickle cell disease. I
can tell you that it's been difficult to watch some of the challenges that my daughter has faced. She's been fortunate enough to go to college, but her life is really different now. The disease has ravaged her kidneys, so she's in end-stage renal failure and spends most of her time preparing to go to dialysis 3 days a week. And on the other 3 days, she's trying to rest for the next time that she has to go. So, and that's really hard to watch. My son has sickle cell disease, and I'm going to tell you about him because I feel like it's really important for you to hear about how we can work together to have a success story for our youth with sickle cell disease. So Emil has sickle cell disease. He gets his care at Boston Children's Hospital, and his hematologist invited him to come and work in his lab. When he invited him to come and work in the lab, I really thought, okay, he's going to have him in there and he'll learn a few things and then, and then that'll be it and he won't get paid for it. But he invited him to work in his lab and he paid him a fair wage, above living wage, and he didn't have him just washing glassware. He actually took an interest in him and believed that this was a person who could learn real skills, real living skills that he could apply to work. And he taught him how to do wet lab research. So now Emil, although he's in college, he has a skill. He can actually earn a living and potentially, at some point in his life, live a middle-class life. So in seeing that, I really feel strongly at this point, and so I have 3 ideas that I think are going to be helpful. One is when we think about federal and state dollars that go towards research and grants, that we have some kind of stipulation written into those grants in which we can provide some type of paid training or internships for youth with sickle cell disease. So if those grants are related to sickle cell disease, that we include, depending on the number of dollars that are included in those grants, we can sort of have a certain number of youth who actually get to participate in those programs and learn some real skills, so that we not only teach them how to eat fish, but we teach them how to fish. Number 2. Organizations that receive, so community-based organizations included, and hospitals that are get federal funds. If there is any type of program that is related to sickle cell disease, they should consider hiring and training people, whether it's the children or youth with sickle cell disease or the caretaker of those people with sickle cell disease. They should consider hiring them into those positions. Like, for example, as Ms. Taylor talked about, as a patient liaison. I mean, who more capable of advocating for a patient with sickle cell disease than a person who is experiencing it themselves or has a child or is a caretaker of someone who has it? So that. Number 3, I think that there should be some type of healthcare, some type of database. I don't know how to think about this really. It's not a fully formed idea. But in hearing about so many travesties that happen in the hospital when a patient goes there with sickle cell disease, whether they're, stigmatized or looked at like they're drug seeking and, all of this type of behavior. If there was some type of agency where this information could get reported and then somehow maybe that could have an effect on the type of federal funding that hospitals or other institutions get for treating patients with sickle cell disease. So there's something that puts a stop to it because I feel like we've tried everything. So that's what I had to say today.
Excellent testimony. Thank you. Please introduce yourself. And
hi, my name is Marissa Taylor. I'm daughter to Laura Taylor, older sister.
It's a famous Taylor family.
And actually, Mr. Yancey, I have seen you at a school that I worked at, and now I'm at Roxbury Prep, and your name has been mentioned as well. And so I feel like we have a connection. a friendship already that we are just now realizing. And so
I'm enjoying every minute of it.
Thank you. With that being said, and I know that you know this, but I'm a teacher, and every day I teach. I didn't even realize that I wanted to become a teacher until I realized how many times I've worked with youth, and I've always tried to figure out where does that come from, and it has come from, in all honesty, my sister and my belief in sharing with kids that they can be anything that they want to be. And even with me saying that, it's a struggle because I know that my sister struggles with that idea in her head every day. And to be honest with you, she is brilliant, more so than I. So that's one thing I will admit to you. But with that being said, I just wanted to kind of put a personal stamp on this for you. So I Googled you, and it says Charles Calvin Yancey was first elected to the Boston City Council in 1983 and began serving his 14th term in office in 2010. He is currently Dean of the Boston City Council, serving longer than any current member of the body. He is chair of the Post-Audit and Oversight Committee and vice chair of the City Neighborhood Services and Veterans Affairs Committee. He is a member of the Whole Housing, Ways and Means, Public Safety and Labor, Youth Affairs, and Human Rights Committee. He is also a member of the special committees.
I hate to interrupt you, and I'm flattered.
Yes.
But this is not about me.
No, and that's, but in all honesty, I'm reading this.
Thank you.
And those are the things that all of these young people here would love for someone to Google them, and those are the things that they have done.
God bless you. Thank you.
So I'm letting you know that in the sense that what we are talking about here today is not something that should be left for 2 months from now, from 2 years from now. These youth, I can't say that as a teacher if I don't mean it. That you can be anything you want to be.
That's right.
And you deserve to have those dreams and to do it in a way that you feel comfortable and safe to do it. So I'm just putting a personal stamp on it.
Thank you. And I appreciate that, and I know exactly what you were doing. I know it's not about me, but I just wanted to say thank you for your compassion, with all the work you do with our young people, and to say that I asked you not to read my bio because folks have been sitting here too long.
No, I know. I wasn't going to read the whole thing because it's long, but I'm just saying in the sense that they deserve that as well. So
I agree.
Thank you.
God bless. Thank you so much. I will. I was going to offer some closing remarks. First of all, was there anyone else here who interested in testifying? I'm sorry. Please step to the podium and introduce yourself. And don't embarrass me.
My name is Rose. My name is Rose Ake, and I'm a registered nurse working at the Brigham and Women's Hospital. And that's my daughter, Beatrice. Yes. She has sickle cell. Yes. She was diagnosed at age 3 months old and had never heard anything about sickle cell. Even the Cameroonian doctors told me it was arthritis of the hands because she was in terrible pain, screaming in pain. I couldn't make out what it was. Yes. So luckily we had an American Peace Corps doctor that actually nailed the diagnosis. And I thought my world had ended. I thought that was it. They told me all the prognosis, how this would happen. But as time went on and we moved to the U.S., my daughter and I determined that we will not let sickle cell put us down. We will not let sickle cell win. We will fight sickle cell. And from then till today, my daughter has been fighting sickle cell. But she didn't do this alone. It was also because of all the help. Coming here with 4 children and with their father back in Cameroon, it wasn't easy. But we had some good resources, which is what I'm hoping will continue for everybody. We were blessed to have some good people in our lives One of them, Dr. McMahon, Dr. Osborne of blessed memory, and the nurse, Casey Ryan, who is at Children's Hospital. They gave us resources. They helped us with transportation. They made it possible for Alma during her hospital visit in Boston Medical or Brigham to have somebody at the bedside. Dr. Osborne himself brought his laptop helping with homework. These are the kind of things we want to see. They helped so much so that Alma was even the class valedictorian, something I never would. She got the Mayor Scholarship and won the Sickle Cell Scholarship for all the 52 states. She went first to Bowdoin University, but because they didn't know anything about sickle, or they didn't know much in Maine about sickle cell, I had to transfer her to UMass Amherst. Then she went to Paris for exchange program where she met the husband, Darius, sitting there, and then they came to the US. But it was only because of all what was available, the resources, the the understanding of some of the professors, that all this was possible. Or even in the university, they gave her a medical room, which means it was a single room, so she could leave the windows shut or open or whenever. Whereas in Bowdoin, she was sharing with 3 other students. Sometimes it's really cold, but those students said they're hot, and she would have crisis every night. Sometimes I have to run to the school to pick her up, to bring her home. So these are some of the things we want them to be considered as human beings, not people from Mars or somewhere else. They just, they just need all the love and support, because they didn't go to this shop to buy sickle cell. They found themselves in this situation. So we need to get all the resources that we can get from, government or federal government to just make them at least, to reach their greatest potential, as my daughter said, and just make life a lot easier for them. And I noticed too that we need to advocate for our children, because Alma would not have been who she is today if I didn't go to the hospital. What is it you are giving her? What is the morphine? She don't need morphine, she just needs Toradol. Because sometimes some of the drugs just make them sleep and sleep. They can't do well in class. I had to follow, even in France, I will be calling to talk to the doctor, or I'll go to Bowdoin to make sure they are giving her the right treatment, because sometimes they just want the patient to shut up, so they just over-medicate. Or sometimes all they needed was just, how are you doing today? Sometimes my daughter called me once when she was in one of the hospitals. She said, Mommy, I don't know, maybe my nurse tonight had a bad day, or she came out of bed on the wrong side. She just came into the room. She didn't even say hi. And I've been waiting for like 30 minutes in pain. She just came and just gave me an injection. And I'm like, who is this? I had to call. I said, I don't usually give her morphine injections. You should have at least find out what works, Just Toradol would help her, because that's the way I've trained her to do. So we have to advocate for our kids' support system. I mean, we do support group, teach one another. We talk to each other what our problems are and how we can help to resolve all of us mothers that are dealing with the same fate.
Well, thank you so much for your testimony, and congratulations on what a wonderful success story we have with your daughter. And it's so uplifting to hear of that success story and so many others. Everyone who came here today is a living, breathing success story. And we thank God for that. And we thank these wonderful doctors and professionals and advocates for this opportunity and for their labors of love. I have even greater understanding now than I had before this hearing began as to why we have such dedicated professionals here. It's because of the human face on the disease called sickle cell and the triumph of the young people who survived the worst pain imaginable, and yet they are success stories, very articulate leaders within our own community. So I want to thank everyone who testified, and thank you so much. But before adjourning this hearing, I think I will ask my friend Dr. Stevenson, Reverend Stevenson, for closing remarks. But I'll ask him to do that after I say thank you to my staff, Lynette Frazier, who worked so hard to make this happen, to Lincoln Smith, who staffed this hearing, to Kenneth Yarbrough, who's with us today, and to Carrie Jordan, who's behind the scenes operating the cameras, but most of all, to a young lady by the name of Jackie Haley, who brought us all together. Reverend, after you close us out, I will adjourn the hearing.
Okay, thanks again, Councilor Yancey, for really putting this together. For me, who have been involved in this struggle for quite some time, 20 years ago, as I mentioned earlier, to see it come to this. 20 years ago, I felt like it was a one-man show. There were times that I felt like giving up, but I thank God for not giving up. And I thank God for this day, and I thank God for the wonderful support that we now have in the city of Boston for patients affected by sickle cell disease. I personally want to thank our executive director, Jackie Haley. I want to thank all these fine speakers here who joined me today in testifying concerning sickle cell disease. We've come here today with several needs. I know the resolution stated that we're here to examine the resources and services, but I would like for us to go a step further and not just examine them. We've heard from so many today the need to really apply these funds, and the time to apply these funds is now. We have had long discussions concerning sickle cell disease, but I really, as the president of the Greater Boston Sickle Cell Disease Association and one whose energy level is running low, I want to thank my wife also over there, Sonia, for putting up with me those long nights when I'm out in the community giving talks about sickle cell, and she's left at home, but always supporting me in this cause, and she's here today. But we need funds to educate the community on sickle cell disease. One of the best prevention for sickle cell disease, I believe, is education. Because today we heard about, a number of immigrants testify, and we're getting a large influx of immigrants coming into Boston and not knowing if they have the disease or even the trait. So we need some funding to provide education around sickle cell disease and around sickle cell trait. We need funds to provide services to patients. The hospitals are I think they're doing a pretty good job in treating patients. We're in a region where we have more teaching hospitals than anywhere else in the world. And we are improving. There's still a long way to go in the treatment of patients with sickle cell disease. But certainly here in Boston, we have the luxury of having all these experts. But what we need are funds to provide not only for research and treatment, but also for the non-medical services that Dr. Zuckerman spoke about. We need funds we need to educate the school system. We heard today from high school students and college students how difficult it is, how difficult absenteeism is for them. But, you know, we need to go in. We need to have the opportunity to go in, or maybe a letter from the city council for some consideration in these institutions for students with sickle cell disease. Dehydration is a problem. You ask these patients, they'll tell you that sometimes just having a drink will help them, but they don't always have the resources to get the liquids that they need. So we're asking for the City Council to really look at these needs vented here today. One patient is asking that we reinstitute the handicap parking, because I brought a young lady with sickle cell disease here with me today, and I was telling her we have to hurry to get to the hearing. And she was going a little bit slow. I said, "Are you okay?" And she said, "I'm fine." But I could see that she was in pain. And walking from the parking lot here was very difficult for her. And so if we could get handicap plates, some consideration. How does that sound? Consideration for handicap plates for patients with sickle cell disease, that is a big need. So after examining all these services and all these needs, I'm praying that the decision of the City Council and the Boston Public Health Commission and all those who have the resources to really help. The resources are here in the city. There's no doubt about it. I mean, we're seeing resources come about concerning other issues. And the resources are here. So if we could begin to have some discussion as to how we're going to apply these resources, now that we have heard the needs for services and the needs for these patients, I think that would make this event a very successful event today. And I know with you, Councillor Yancey, championing this cause, I know I can look, and the patients here can look for some kind of results from this hearing today. I just don't believe we came here to talk. I believe that we will get some results, and I'm going to remain hopeful about that. Thank you very much.
Thank you.
I'm so glad to be here.
Thank you. Thank you very much, Reverend. Concerning docket number 0451, order for a hearing regarding resources and services available to individuals with sickle cell disease. This hearing is now adjourned. But before hitting the gavel, I would request, if it's appropriate, if everyone can gather right over here and we can do a group photo for the organization.
Yes.
We'll be happy to do that. So everyone from over here, if you mind moving over to that area. And at this time, I will now, no, you folks stay there. At this time, I will adjourn the hearing.